Joining us now is the White House COVID-19 response coordinator, Dr. Ashish Jha. And Dr. Jha, thank you for joining us this morning. It took 78 days for the White House to declare a public health emergency after the first confirmed case of monkeypox in the U.S. Should this have happened sooner?
Yeah, good morning, Michael. First of all, thanks for having me back. Look, since the first case, we began working immediately to try to respond to this virus, right? So started ordering vaccines, making sure tests were becoming widely available, making sure treatments were widely available. So the White House has taken this very seriously from day one. You know, the public health emergency adds extra tools to our toolbox, allows us to speed up vaccines further, allows us to unlock new funding. So there are a lot of good reasons to do the public health emergency now, but I think we've been taking it pretty seriously since day one.
And Junaid, she just reported on the new vaccine approach that could see vials split into smaller doses. If they are split, are they as effective, and are they being split because the administration did not secure enough full doses?
Yeah, it's a good question, Michael. Here's how I think about it. Number one goal of any decision, no decision's been made, by the way, about whether we're going to do any splitting of the doses. Number one goal is to make sure the vaccines remain effective and safe, right? There's no point in doing this if we're not going to have vaccines that are safe and effective. So we're going to absolutely 100% make sure that that's the case. If that happens, this is pretty common in medicine. We learn new things about vaccines, about treatments, about dosing, and that's what the FDA is looking at right now, is what is the best way to get these doses out to Americans who need them. And this is an approach that we don't have a decision. We'll be driven by data and science, but that's what the FDA is looking at right now.
And when can we see more doses of the vaccine roll out?
Yeah, so we're trying to speed up more vaccines, right? We were supposed to get a whole bunch in November. We've been able to get that moved up to September, just next month. We're working with a bunch of manufacturers to speed up more vaccines. I want to remind Americans, right now there's one small company in Denmark that's making all the vaccines for the world, and they're going 24/7. What we're doing is trying to expand that capacity, get more manufacturers and get domestic manufacturers in, so we can start getting a lot more doses made right here in the United States and available to Americans.
And we know that monkeypox is spread primarily through skin-to-skin contact, but can you also get it from services like public transportation seats or playground equipment? Do we need to start wiping things down?
You know, Michael, right now there is no evidence that it's spreading in any of those places. Obviously, we're monitoring that very closely. Have not seen any cases through playgrounds. Have not seen any cases through public transportation. It's really prolonged skin-to-skin contact, and that really is where the virus is spreading. Obviously, if we see new evidence that it's spreading elsewhere, we'll share that immediately with the American people. But I'm not worried about those as major mechanisms or even minor mechanisms of spread.
All right, Dr. Jha, thank you for your time. We always appreciate it.
Thank you, Michael.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.